15 minutes after the hour. So a drug that is prescribed to help with weight loss, Wegovy, is showing some promise for treating something else.
A clinical trial showed it reduced symptoms in people who are obese with heart failure. So let's bring in the Fox Medical team's Dr. Mike live this morning to talk about this trial. Dr. Mike, good morning to you. Are we hearing this right? This could be a treatment for heart failure?
You better believe it. Lena, Sally, I do have a heart. I brought it today right here. And basically what this study found is that people who were on the drug Wegovy, aka semaglutide, that's a drug that is FDA approved for weight loss, dramatically reduced the risk of death and complications from congestive heart failure. Now, congestive heart failure is a condition, and there are a lot of causes of it, but the kind of congestive heart failure in this study, people develop fluid overload. And traditionally, we use water pills, diuretics they're called, to get the fluid off, and that can have problems, side effects. What this drug did was not only reduce weight, which is always a very positive thing, but it also was found to decrease inflammation and the congestion associated with congestive heart failure. So if this pans out, and this study is one of a couple coming down the pike, if you will, it could be a game changer in terms of how we treat people with congestive heart failure in this country.
So just to clarify, would it help people who have not had or are at risk for heart failure, or people who have already suffered heart failure?
Well, this study looked at people with congestive heart failure, but I've got to tell you, I have so many patients on these new types of weight loss medications, whether it be for diabetes, like Mounjaro, Ozempic, or obesity. Remember, Wegovy is the same as Ozempic, only it's FDA approved for people that are considered obese. So it's been revolutionary. Let me tell you something, Lena, Sal. Yesterday, I went out to my waiting room and I saw a woman and I didn't recognize her. It turns out it's been my patient for a long time. She'd lost so much weight, I didn't know who she was.
Oh.
And so this has really, that's why you can't find, it's hard to get these medications, and it's revolutionized the way we deal with not only obesity, but type 2 diabetes, as well as now studies looking at things like congestive heart failure. I think this is really, at least in my practice in 30 years, I've never seen anything like this. It's dramatic.
Yeah, knowing a lot of people who've had success as well, I have to say I've never seen anything like it as well, and how it's taken off. I mean, if it improves quality of life and helps with other things, then that's great. Dr. Mike, thank you for joining us.
One other thing, listen, it's been shown to even reduce the desire to drink alcohol. It's anecdotal. I've been seeing it with my patients. That's another possible venue or way to go with this. But look, I want to leave it. How come you call Brother Mike from the weather? I want to be Uncle Mike.
Oh, you're like our uncle.
You can be Uncle Mike.
You can definitely
be Uncle Mike.
All right.
Thank you.
He's Brother Mike, I'm Uncle Mike.
All right,
Thanks, Uncle Mike.
Next time we'll get it in the master rundown, like that always. Uncle Mike.
Uncle Mike.
Okay.
All right, now to our